Hello, everyone. Recording in progress. Hello, everyone. Welcome to the launch of the Australian Research Alliance Health Research Hub. I'm Ainsley Kale, a health consumer advocate and one of the chief investigators of the MRFF-funded research study, which has resulted in the hub we're presenting to you today. I would like to acknowledge the traditional custodians on the lands on which I'm joining you from today, and that's the Gadigal people of the AHRA Nation, and all traditional custodians of the lands on which you are connecting from today across Australia. I pay my respects to their elders, past and present, and also my respects to all the Aboriginal and Torres Strait Islander people who are joining us today. Contributing to this 2-year study has been an absolute delight. Consumers have been involved in every stage, and it's been a truly collaborative effort with consumers, patients and carers, health consumer organisations, clinicians, researchers, institutions. We've also had health consumer organisations such as Consumers Health Forum of Australia and a vast network of researchers and clinicians. We're delighted to welcome Professor Steve Wesseling, CEO of the NHMRC, to our launch. Today you'll be hearing from Steve along with several members of our research team who will describe the co-design process for developing the Health Research Hub and tell us about its key features. Firstly, some housekeeping. Microphones have been muted to minimise background noise. Please use the Q&A function for comments. The team will monitor and respond throughout the session. Resources and links will be shared via the chat function. The session, as you would have seen, is being recorded, and we estimate the webinar will run for about an hour. Now I'm pleased to introduce Professor Carol Hodgson, who is the Executive Director of Monash Partners Health Translation Network and Chair of the Australian Health Research Alliance. Thank you, Carol.
Thank you, Ainsley. I'll just share my slides. See if I can get this slideshow up. Are you seeing the slideshow or the presenter view?
Seeing the slides.
Great, terrific. Okay, thanks so much, Ainsley, and it's such a pleasure to be here. As well as being part of the research team, I am also the chair of the Australian Health Research Alliance, as Ainsley said, and it's my great pleasure on behalf of AHRA to congratulate the team on the launch of the Health Research Hub. Let's just see if I can get my slides to advance. I'd also like to acknowledge the traditional custodians of the land on which I'm sitting. For me, it's the Boonwurrung people of the Kulin Nations, and just pay my respects to elders past and present. So a little bit about AHRA. AHRA is the voice of the 12 National Health and Medical Research Council accredited research translation centres and 2 emerging research translation centres that sit across Australia. Each centre is a partnership of health services, research centres and universities, and our members encompass more than 86% of Australian acute healthcare services. This is a map of Australia where you can see where the partners sit. And, you know, today we have representatives from Monash Partners, but also from Western Australia Health Translation Network, and also Ainsley, who's sitting in Sydney, which is wonderful. So it really has been a collaboration across many of our research translation centres. AHRA is the peak body for the 12 RTCs, and our mission is to support health and medical research to be translated and embedded into healthcare, to improve health outcomes, health equity, and health economy. We do that across 3 strategic themes, and the first one is supporting a strong multidisciplinary research translation workforce. The second one is to facilitate health research translation into healthcare delivery. And the third one is advocating for health research translation and evidence-based healthcare. And we do all of those in partnership with consumers and the community. We have key activities that we try to address in terms of advocacy on research translation across national and state platforms with our national funders, the NHMRC and the MRFF, and input into the National Health and Medical Research Strategy. And we have aligned partnerships, and these include the Australian Clinical Trials Alliance, the Australian Academy of Health and Medical Sciences, and Research Australia. We have networks and collaborations that we work across, and I believe the largest and the strongest of those is our Consumer and Community Involvement Network, but we also have networks across women's health, data, and the Australian Clinical Trials Education Centre, the AC Tech Online Clinical Trials Training Program. But I want to focus today on consumer and community involvement for AHRA, because we have for a long time had a vision for consumer and community involvement, and that is to embed the involvement of consumers and the community in health translation, ensuring that it's intrinsic to and embedded in the operations of all health research bodies, that it reflects a genuine sharing of power, mutual trust and shared values, and that Australian consumer and community involvement is world-class, the best that we can possibly offer. We've worked across several priorities, and one of those has been a practical handbook to guide stakeholders and organisations in embedding CCI, and this was launched in 2022. To establish a knowledge hub that brings ideas, knowledge, tools, research, and activities together, which you'll hear more about today, and identifying and testing approaches that show if involving consumers in health research make a difference and the kinds of effects it has in different research settings. And finally, to establish an international consumer and community involvement alliance. So there's been a history since well before the pandemic. In 2016, we had our first national engagement for NHMRC, the review of the 2016 statement. In 2018, we had our national collaboration vision and priorities set. In 2020, we had a joint position statement on consumer and community involvement. In 21, we launched the handbook, we reported on available tools, and we scoped out projects for the CCI Online Hub. In 2024, we've had national engagement for review of the NHMRC Consumer Statement, and this year we're launching the Health Research Hub. And a huge congratulations to all of the team who've worked so hard to get it to this point. So I'll stop sharing there and just say how delighted we are to be part of the journey for the Health Research Hub. And on a final note, I'll hand over to Steve Wesling, Professor Steve Wesling, the CEO of the National Health and Medical Research Council, who will speak for a few minutes. Thank you, Steve.
Thanks very much, Carol. And I'd also like to acknowledge traditional owners of the lands that we're on today, right across the country. I'm on Ngunnawal land, and I'd like to acknowledge the Ngunnawal people. Also like to acknowledge any Aboriginal or Torres Strait Islanders who are joining us today. And it's terrific to be here. And, it's great to see all of that work that AHRA is doing. And I'm really looking forward to the webinar and hearing a whole lot more about the hub. But from an NHMRC point of view, we've really seen consumer and community involvement as being essential for research for a long time. And obviously we've done that through our advisory committee, and more recently, our Consumer and Community Advisory Committee has joined with the MRFF Advisory Committee so that we only have one committee advising both the MRFF and the NHMRC. And that actually has been a great move forward. And we get terrific advice from our advisory committee. But the NHMRC clearly sees consumer and community involvement as being essential for high quality research, and essential right from the beginning to the end. So from developing the idea all the way to policy or a new drug or a device. And unless we do that, I don't think we get high quality research. So, and I think importantly, that therefore means that our biomedical researchers, our clinical trialists, our public health researchers, all our researchers need to take community and community involvement seriously. In terms of what we've been doing recently, as I'm sure you know, we've undertaken extensive public consultation on the draft statement on consumer and community involvement in health and medical research. And we've done two national consultations. One was conducted by AHRA, as we just heard, and the other was conducted by the Kids Research Institute. And through that process, we've had 24 in-person and online roundtables, had about 500 people involved, and we've had about 117 online survey responses. And all of that indicates to us and those people being involved have indicated to us the importance of CCI right from the beginning to the end of research. But also there was a very strong message from everyone involved that more implementation material was needed, preferably from some sort of central database of resources. And I think we'll hear today that that's exactly what we're getting. But what they told us was it was really important to allow consumers and communities to find out how to get involved in research, to find out how to get involved in basic research, because often that's a little bit more difficult than a clinical trial or some public health research, to get guidance on co-design, trauma-informed practice, working with priority populations, remuneration and budgeting. Really, some of these are quite difficult areas, and having information on these and advice on these, I think, is really important. And then finally, training programs for consumers and researchers, because we want our consumers well trained, but we need our researchers well trained on CCI as well. So again, I'd just like to congratulate AHRA on this terrific resource, and also the work that AHRA has been doing in CCI over a long period of time. The other thing that we've been working on, which I'm sure you're aware of, is the first national strategy for health and medical research. We've actually never had one before. We've had some reviews, the McKeon review and the Wills review, but now we're developing a national strategy, and we've done a lot of consultation. Again, 8 roundtables, 20 targeted discussions, 304 written submissions, and we've had these discussions. We've had some thematic ones which have been around commercialization and data. But again, I think the consumers and communities have again pointed to how important it is that they are front and center in the national strategy, and that we look at implementation mechanisms and strategies to ensure that there is CCI involvement in all stages of research, and again, that appropriate resources are available. So we're now working with the teams on finalising both our statement on consumer and community involvement and our Australian National Strategy for Health and Medical Research. And both of those hopefully will be available early in the new year. And so it is actually a really exciting time. And there's also actually a strategic examination of research and development ongoing. So some really important work, strategy work in all of these areas happening across our sector. And I'm really looking forward to the new year when all of these things come out and we take them forward. But finally, I'd like to again congratulate AHRA on the Health Research Hub. I think it's a fabulous outcome. It reflects a lot of work, but also a lot of passion, a lot of partnership, and it certainly shows the momentum in the CCI area. And again, that aligns so well with NHMRC's view of the importance of consumer and community involvement in health and medical research. And really, if we don't have it, we don't have high quality health and medical research. So thanks for asking me to say a few words, and I'm really looking forward to the rest of the webinar. Thanks a lot.
Thank you, Steve. Great things lying ahead. We appreciate your kind words. It's now my pleasure to introduce Professor Helena Teed, AM, Chief Investigator of the Consumer and Community Involvement Implementation Research for Impact Project, as well as Director, Monash Centre for Health, Research and Implementation, Monash University, Monash Partners. She's joined with Dr. Angela Jones, Health Research Hub Partnership Lead and Senior Program Lead for the same research centre as Helena. Thank you, Helena.
Thank you so much, Ainsley, and thank you to Steve and Carol. I'll just share my slides. So thank you very much, and I have to acknowledge the traditional owners of the land on which we meet, and for my particular case, it's the Burruan people of the Kulin Nation, but also, as Steve has highlighted, welcome to acknowledging all of those countries across Australia.
You're not quite in presenter mode.
Thank you. There we go. So I'm going to tell you a little bit about the Consumer and Community Involvement Implementation Research for Impact. This was funded through the MRFF consumer stream for funding, and it really genuinely was a community and consumer priority. So I have the privilege of launching this today, but I want to emphasise the team who were all involved, not just the investigators who are listed there, with many of our consumer investigators as well as our academics, but also to say this was work of a much larger team. And it was in the context of Monash Partners Health Translation Network, also co-led with Western Australia Health Translation Network and Sphere from New South Wales, as well as all the AHRA centres with input. So in terms of this particular project, it was an opportunity to apply research and best practice methods to solving a difficult and wicked problem. And as Steve has highlighted, whilst it is the role of the NHMRC and the Office for Health and Medical Research and other policy agencies to create our statements and our leading policies, it's often challenging to then implement that work into practice across the country. And this project was really aiming to align on that journey with our policymakers, but actually to create top-down and bottom-up resources that would really help deliver that. So the aim here was to generate new knowledge and implement evidence-based solutions to embed consumer and community involvement in research to improve relevance, translation, and impact. I won't go into this in detail except to say we used very robust methods, which is why this was funded by the MRFF. We used the Consolidated Framework for Implementation Research to map all of the stakeholders across the system. We then used a learning systems approach, which I'll go through shortly, and then evaluation is being undertaken using the RE-AIM framework. And the protocol for this work is published if there are others who are interested in the detail. Essentially, when you're looking at implementing for multi-level change, what we did was we took evidence from stakeholders and consumers, and that work was done by AHRA, as Carol has highlighted there, in the many years leading up to this project, where wide stakeholder engagement with very strong consumer engagement from priority populations as well was undertaken to establish the priorities for this work. And that also aligned to the priorities from many of the centres, including Western Australia and Monash Partners. In response to that, we then designed this project to deliver the other quadrants for change, looking at evidence from external research and evidence synthesis, evidence from practice across settings across the country, and then evidence from actually co-designed implementation strategies, of which the hub is one key component, which we're launching today, but there's also an organisational toolkit. So the hub supports individuals, the organisational toolkit supports the organisations, and then we've been in the fortunate position of being able to engage with NHMRC on their journey around the statement. So the actual research program, again, I won't go into too much detail, except to say that there were multiple work packages, building multi-level networks of consumers and researchers, building and co-designing the actual digital knowledge hub with a diverse range of resources and tools, which is a living resource that will improve over time. We also applied behavioural science to understand the attitudes and beliefs and adoption around this. And we also incorporated significant case studies from around the country, including in priority populations, and applied implementation science methods for ensuring we end up with significant scale up and reach. I'm going to talk about the hub primarily today with Angela, though. And I'll hand over to Angela Jones now just to run through some of the key data sources that we used.
Thanks, Helena. Just to highlight everyone, some of our data sources. So obviously, Helena's indicated there was a big focus on evidence synthesis in this project. And our data sources included a national survey of the behaviours and attitudes and barriers to the adoption of consumer and community involvement, and that was a national survey. We also undertook about 70 semi-structured qualitative interviews with consumers, researchers, leads of the research translation centres, funding bodies, health professionals, health service managers. It was a very, very broad group of stakeholders. In terms of hub development, that was progressed through an iterative co-design process with a series of workshops held with consumers, researchers and health service managers and health professionals, with them iteratively providing feedback and that being co-designed at every stage. In the context of this bigger project, we've also developed some case studies, real-life examples of consumer and community involvement in the context of emergency care, improving stroke outcomes in Western Sydney, and also working with Aboriginal and Torres Strait Islander communities. We were able to integrate into this project some of the findings from a national consultation that Monash Partners led on behalf of the NHMRC with AHRA last year around revisions to the National Statement on Consumer and Community Involvement in Health and Medical Research. So the outputs from all of that research are a co-designed health research hub, which we're launching today. Also, as Helena has mentioned, an organisational implementation toolkit to support CCI in research organisations and input into policy. The hub has been user tested, but we will be evaluating it using the REAIM framework in the months ahead. Overall, the project has really enhanced our understanding of the knowledge, attitudes, beliefs and barriers and facilitators to consumer and community involvement. And what we've been able to do is integrate all of the themes from the research into the key messages within the Health Research Hub. Next slide, please, Helena. This is just a slide that describes a little bit more about the consultation process that occurred in 2024 with all of the centres working together. There were 22 workshops that were held, very strong consumer and researcher engagement, and we had the opportunity to integrate that data as a data source into this overarching project. I mentioned that we held a series of co-design workshops to iteratively develop the Health Research Hub. We were very fortunate to work with some leads in co-design through Monash University, our lead academic partner. This is just an example of one of the methods that we used in one of those workshops, and it was around a journey map and having a healthcare consumer complete this map as they engaged with the Health Research Hub in its very early days. And we explored what their expectations, their thoughts and their emotions were as they engaged with the content on the hub and with the design of it as well. And so all of this feedback was iteratively explored until as we moved along through a series of workshops to the hub that we've launched today. Just to highlight, the hub is a one-stop shop, really. We know that there are many amazing resources in consumer and community involvement. Often they're very difficult to find. They're spread across many organisations and platforms. And so what the Health Research Hub does is curate those and bring them all into one place. It also provides real-world examples of researchers and consumers working in consumer and community involvement in particular areas and talking about their experience and what's worked well and what have they learnt. We've also established a LinkedIn platform as an initial opportunity to connect and to explore learnings around consumer and community involvement. And we will host a series of events in 2026 that will be freely available across the Australian community, as well as a newsletter. Thanks, Helena. Next slide. But over to you.
Thank you. So just to give you a bit of an outline here, so working across the fact that we're supporting, up in the top right-hand corner, we're supporting individuals, as in members of the community, organisations around that inner setting and linking to policy. So across those, we set priorities, as we mentioned. That was actually what took us into the grant, the priorities from organisations such as Monash Partners, the Western Australian Research Translation Network, and then the national consumer and community priorities across AHRA. And being able to understand those stakeholder perspectives and what the problem was and taking the priority into this grant was really important. We then undertook scoping reviews on, for example, strategies around health networks around research. We extended our work to generating quite a lot of new knowledge because there's not a lot of evidence on best practice here, despite the fact that we all, as Steve says, quite passionately focus on this being important and we recognise the importance. Best practice is not exceptionally well defined. So there's a lot of work that will be coming out of this subsequently, which is in the process of publication, to define that best practice around process. We then looked at what everybody is currently doing, and it was very fortunate that we were able to access and use the data that NHMRC had collected around this national statement as an additional source of evidence in this context. And so we looked at what was happening nationally, and we did that through the extensive data collection that Angela has outlined, but also through some deep dives on case studies, including in Indigenous community engagement and in a number of clinical case areas. Then we also incorporated that NHMRC consultation data. And as Angela has said, the Knowledge Hub gives you things like a simple definition of what consumer and community involvement really is in research. Then it actually gives you a range of quite important resources and tools. For example, standard operating procedures, strategies to reach out to your community, ways you can involve consumers anywhere from in your governance through to in consumer advisory groups and networks through to reaching out to priority populations, gives you role descriptions and, for example, remuneration guides. So it really is a step-by-step process and also offers the opportunity for more standardisation. Having had the privilege of going on the journey in the UK, where I have another appointment, and looking at their consumer and community involvement journey, it's been quite ad hoc. It's been a strong priority and push from the top, but in fact hasn't necessarily followed best evidence-based practice and had this sort of system-level approaches to being able to implement it. And it was a real privilege to have the funding to be able to do this. And it does also align very well with the Medical Research Future Fund outcomes and success metrics. If you look at many of these, as Steve has alluded to, consumer and community involvement underpins the majority of these. And we anticipate and hope very much that this project, which will be very good value for money really, will help accelerate most of these success metrics. On that, I'd just like to acknowledge all those who have contributed, and especially the people who are on the panel next to were very involved. But you'll also see the research investigators here, including our Indigenous investigator and our other key people from across our lead agencies, as well as the research team. And on that, I will stop sharing and I'll hand over now to Ainsley to chair our panel. Introduce
Okay.
the panel, beg your pardon.
Yes, sorry. I thought you were going to do
Yes, I
that.
am. Ainsley, you're absolutely right.
I'm very happy to introduce the panel. Would that help you?
Yes, that would be wonderful.
Okay, terrific. In no particular order, though, we first of all have, let me quickly look at my notes, John Asghari, who is a consumer, health consumer advocate who's been involved in the project. We have Ashley Ung, who is part of the research team. We have I'm just looking around. We've got Sandy Reeder, who's the lead qualitative implementation research at Monash Centre for Health Research and Implementation. Gosh, many words, isn't it? And also the wonderful Deb Langridge from West Australian Health Translation Network, leader of the consumer and community involvement. And at the end, I will just start a little chip in as well. So thank you, Helena and Angela.
An amazing team of people here. So I'm going to start by just asking you all to add a reflection on the co-design process and developing the hub and highlight a key feature of the hub. And I'll start with you, please, John.
Thank you, Helena. Good afternoon, everyone. I'm delighted to share my reflections as a consumer involved in the co-design of the Health Research Hub. Firstly, I would like to acknowledge the Australian Health Research Alliance and the Medical Research Future Fund for all their support. Regarding the co-design process in the hub, I should say it was inclusive collaborations, which consumers will engage at every stage, not just consulted at the end. It was shared decision-making. Our voices shaped priorities, language, and usability of the hub, and also respect for lived experience, which is researchers value consumer perspectives as expertise, not just feedback. I have also seen the value of this approach through my involvement with the Australian and New Zealand Intensive Care Research Centre. The collaboration showed how consumers and researchers working side by side can lead to more effective and meaningful outcomes. By bringing a lived experience into intensive care research, we help ensure studies were not only scientifically rigorous, but also deeply relevant to patients and families. The this reinforced for me how consumer partnership can positively impact research direction and outcomes. And regarding the learning, if I want to mention, the co-design builds trust. Continued involvement fosters confidence in research process. And also practicality matters, which consumers want tools that they are easy to navigate and applicable to real settings. Also, evidence plus lived experience is equal to stronger outcomes. Combining rigorous research with consumer insight creates resources that are both credible and relatable. And also, sustainability requires ongoing dialogue. The LinkedIn discussion platform is a reminder that involvement doesn't end at the launch. It is continued. And if I want to highlighting the key future of the hub, I have to say consumer and community involvement organizational guides, which provide clear practical steps for research organization to embed consumer involvement, helps ensure consistency, accountability, and meaningful participation across the project, and also empowers both consumers and researchers to work together with shared expectations. And if I want to summarize my reflection, I have to say, for me, the Health Research Hub represents more than a digital platform. It is a commitment to partnership. It shows what's possible when consumer and researchers co-design together, and it sets a stage for more inclusive, impactful health research. Thank you.
Thank you, John. Always fantastic. And your efforts during the co-development were fantastic. Thank you. Ashley, I'll ask you next.
Everyone, thanks for having me on board. So I've been with the project from the start to the very end, even now. And I think my biggest reflection and takeaway is how collaborative everyone has been on this journey, from the research translation centres, from AHRA, to all the people that we've interviewed. Everyone was more than happy to have a sit down and have a chat with me around what consumer and community involvement is like currently, what they're currently doing, what the challenges are, what they would like to see. And it's really exciting to see the potential that this hub could have and will have down the track as well. And I think the biggest takeaway for me is also the real life examples and the communication and the opportunities for networking as well from here. So, for example, we've got the LinkedIn group that I shared a link for it before, and I can pop it in the chat again. It's really an opportunity to sort of get together and see what conversation comes out from it, so that we can then fine tune what comes out from the hub later on as well. And then there's also case studies in terms of how do you actually apply consumer and community involvement methods in your own research areas. And so we've been really focused on trying to have a wide variety of different examples, and we're still collecting examples that we'll showcase. So I think it's all about learning from each other and opening up communications for opening up channels for communications. And really, this is really just the start of something bigger. So I'm really excited to keep continuing on the work with these amazing people and to create more networks and have much more from this hub. Thank you.
Thanks. And I'm going to ask Deb, who's been one of the passionate drivers behind this project from the outset. And anyone who doesn't know Deb knows that she, like Ainsley, very much embodies the critical need and the enthusiasm that we have to advance. Over to you, Deb.
Thanks, Elena. I think one of the great things about the hub, and the intention from the very, very beginning when we first started talking about it as part of the bigger project, was for this to be a connector. It's easy to, regardless of what kind of hat you wear, whether or not you're a researcher, a consumer, whether you're an academic institution or even a funder, it's easy to just put your head down and keep doing your own thing. And so the intention of the hub was to connect people regardless of your area of interest, or if you have more than one area of interest in terms of involving lived experience voices in research. And so the opportunity that the hub provides is not only to provide lots of this is what CCI looks like, information and case studies and resources, but also to connect people together to each other, and that can be done through the LinkedIn group, but also connecting importantly to the AHRA centres. And so, as has been mentioned, there are 12 accredited NH&MRC research translation centres all over the country and another 2 emerging centres. And the hub has the opportunity to connect researchers and consumers, people who are interested in wanting to know more, to connect to each of those research translation centres. And that's the beauty of not having to Google, go back into a search engine, shouldn't name that, go back into a search engine and try to find and come up with a list of things. So the hub is there to connect people, but also for those next steps. It provides preliminary information, but if you're wanting to know more, if you're wanting to do a deeper dive or connect within your state or within your health service or university, the AHRA hub has that opportunity to be able to do that. And I think that's really important to ensure that we are working alongside each other in collaboration with each other, but also to reduce the opportunity of reinventing a wheel. Nobody wants to do that, which has been part of the joy, I think, of working on the hub. And as the chair of the AHRA CCI Advisory Committee, each of our research translation centres come together to talk about how we work together, how each of our centres work together in terms of involving people with lived experience. And so this is just another opportunity to be able to do this well, I think, through the hub.
Thanks, Deb. And just noting that Deb now, as mentioned originally, is the chair of the AHRA Consumer and Community Involvement Group and Platform, so really important liaison role. Sandy.
Thanks, Helena. My reflections are particularly around what a really fantastic and collaborative process of iterative learning that we've gone through in this journey, right from start to beginning and ongoing into the future. So lots of listening, adapting, reworking, but overall an incredible trajectory and process of improvement together, which I have to say was profoundly fulfilling and really exciting. It has brought me, I can't tell you how much joy to see all the resources in one place in the Health Research Hub. It feels really quite transformative from someone who spent so much time digging out very fragmented resources across many platforms. So to have the resources in one site from trusted, best practice, resources, documents, templates, group chats, all sort of co-located, as I said, feels incredibly transformative, particularly around the opportunities to advance consumer and community involvement as a practice and not have to keep duplicating documents because they're there in one place. So, yeah, overall, an amazing, wonderful process and an absolute joy to be part of. Thank you.
Thanks, Sandy. And if I can just reflect that, so often we try and do this sort of work with very limited resources. For example, I'm sure Steve will tell you, but it's not necessarily well-resourced in terms of our research funding bodies to be able to work on best practice implementation evidence. And the joy here of having consumers absolutely as co-leads, not just as consultation partners in this pathway, but also to be able to work with the policymakers and the community and everybody in terms of stakeholders meant that we could use best practice research for actually the intention the MRFF is there, which is to do research to ensure that we deliver better outcomes for Australia. And I'm now going to hand over to Ainsley, who has been, again, an absolute powerhouse and a real privilege to work with throughout this process. So, Ainsley, over to you.
Thank you, Helena. At the risk of being that annoying person who repeats what everyone else has said, from my personal perspective, I think Steve Wesling nailed it when he talked about the passion and the partnership, and also John, Deb, the others who have highlighted Most importantly for me, because I've been involved in health and medical research for 22 years, the advances that we have made and culminating at the moment with the Health Research Hub is an absolute highlight. The collaboration, the extensive collaboration, the respect, and in particular, the respect for various people's experiences and their knowledge and viewpoints. And I think that is absolutely led to the success of this project. The other point that I know everyone is delighted with, and including the people who registered today, is the fact that we now have a one-stop shop for resources. And we have curated quality Australian and international resources that can help all sorts of stakeholders. So the advantage of just being able to go to one website is terrific. We recognise that there are some things missing. For example, we need to work further, and we will, about consumer and community involvement with discovery basic research. And there's also some excellent case studies showing success stories with a range of groups. That includes Aboriginal and Torres Strait Islander, CALD groups, different communities. And I think often if you see what other people are doing, it can spark an idea for how you can improve your work in consumer and community involvement. So it's been terrific. Thank you.
Thank you so much. And there's some great questions in the chat. So I think I know we have been answering some of those, but there's the opportunity to perhaps raise a few really important ones. So Frank Coley has noted that consumer and community involvement is limited to those who are fluent in English. Will there be funding provided by the NHMRC and the MRFF to include this cohort in community engagement and research? Because they often lack access to consumer engagement and participation. And it's rare to see a study in which we include those who are not fluent in English. And that's from someone who sits on a Human Research Ethics Committee. So there has been strong engagement across this project, but also quite a few other activities ran around engaging populations who are not necessarily English speaking in the first instance. And many HRECs and organisations have actually gone to the extent of discouraging, if not actually requiring research. So discouraging exclusion of those who don't speak English and actually requiring inclusion of those who do not. So I think we can ask for comments across the board, but definitely something that is a key gap. And there is also, as you can see in the chat, Ashley and G's put in some details there around some of the case studies about working with populations. And there's some resources in the hub itself about how you reach out to some of those priority populations, including those who are not fluent in English. But I think your point is really important.
And Helena, can I just mention as well that as a member, and Ainsley is the chair of the NHMRC MRFF Consumer Advisory Group, this is a conversation that is always coming up at those meetings about what does this look like in future, both with the NHMRC and MRFF in terms of the actual practical application of grant programs. How can we ensure that people are aware and can be involved if you're if you are not a traditional English speaker, if you're a diverse culture. But the other opportunity, I think, is that both the developing consumer statement, the new one for next year, as well as the National Health and Medical Research Strategy, both identify this as an important part of true and meaningful consumer and community involvement across all different cultures and all communities. So it is on the agenda, and the people who are in the room trying to represent issues and current themes. Thank you, Fran, for raising it. It's a good question. It's an important one. And please know that it has not fallen off the page, so to speak. It's something that the members of the Consumer Advisory Group, of which there are diverse cultures, are actively keeping this on the agenda and speaking to it as we go along. So it's good to keep raising it because it keeps everybody accountable.
And it also highlights, Deb, that your role and Ainsley's role as leaders in the CCI space with our funding agencies are obviously still continuing to pursue many of these important agendas as we go forward. This is not all the solutions, but it definitely highlights it. Another question, and we might see whether whoever wishes to address this too, is the question about discovery research. So because this was an evidence-based journey, one of the challenges here is that there is very little evidence about what is best practice for consumer and community involvement in very fundamental discovery research. Once you start to get across the research continuum, it becomes increasingly clear how critical consumer and community involvement is, especially in applied implementation. But where we're talking about really early discovery research, there is very little evidence. And in fact, some of the challenges around this space is that the people who are involved in that research often don't have training or skills. For example, AHRA registration as health professionals may not be as aware of consumer and community confidentiality, and indeed even the roles of consumers. So we found some good, but also some concerning examples of engagement of community members in very, very early research. And that's one of the reasons why at this stage where that's the next step in terms of actually generating the evidence about that. Ainsley, did you want to make any comment about that, or anybody else?
Yes, thank you, Helena. That's absolutely right. This is something that we are turning and had turned our mind to beforehand. It's something that we wish to develop. I think currently you will find that around Australia, it's piecemeal when it comes to discovery and basic research. There's some excellent examples, but what we need to do is harness those, bring them together, work with the relevant communities, researchers, to just get a sense of what is best practice. So we haven't forgotten them. We haven't forgotten that side of it, but there was just so much we could do in the first stage of this particular study. Thank you.
There is a case study on the hub for those that haven't found it yet. And I'm not just saying that because it's a WA example, but it's a great example of how an amazing person with multiple lived experiences of conditions, but also as a carer, is continuing to work with some discovery scientists at Harry Perkins and UWA, and the actual semantics of what that looks like. Tips and ideas and thoughts and bits and pieces. So turning that theory into practice. And there, I mentioned in the response to the question that was asked that there are lots of health translation centres amongst AHRA that are running really great practical training workshops of this is what it looks like in practice. And WHDN last year ran a CCI in basic science showcase where we're showcasing examples. So the more you can share, either as consumers or researchers with us via the hub, the more we can be sharing those at a national level to be turning the theory of CCI into practice, which is that's the translation process. That's what we want to be able to be doing, and the hub allows us to do that.
Great, thank you very much, Deb. And by no means are we necessarily saying it isn't appropriate, but it is important to say we've got some case studies, but this is one of the next priority areas for research. The other finding about the work that we've done is that, interestingly, and this is an evidence-based statement from the interviews and surveys, healthcare providers in the healthcare setting see consumer and community involvement in healthcare improvement as being the job of researchers. Researchers see the healthcare improvement as being the job of clinicians. And it's really interesting to think about this because, in fact, the system, the Quality and Safety Commission, the jurisdictions, the agencies that you will involve in consumer and community involvement in healthcare are actually very different to those you would involve in research. And so the two key areas that we have prioritised, or three, I suppose, one is priority populations, including non-English speaking, but the other two, as Deb said, are finding best practice examples, but also doing the research on what this looks like and doesn't look like in discovery research, and then also how it needs to be adapted for healthcare improvement. Many principles are common, but it's not the same and the stakeholders are not the same. Does anyone else on the panel want to make any comments about any of things? There are more questions, but just checking if anybody wanted to make any particular comments.
I just wanted to add, there was a question in there around, if you miss your window of opportunity if you don't involve consumers from the very start of your project? And we have specifically worded our content to make it broad so that you can actually include consumers at different stages of your project. Ideally, you would include them at the very start, but we understand for some circumstances that can be quite challenging to do. It's around focusing on the principles of how you're working with consumers, having a solid plan of when you do start to work with them as well. So it's all there. It's just how you tailor it, and there'll be also reaching out to your local AHRA accredited NHMRC accredited research translation centre to see how they can support you for your individual projects as well.
Great. Yeah, and just also to highlight, whilst we can't possibly do this with people with lived experience from every condition, there was great consideration given to, for example, those who were non-English speaking, those who had conditions which would make it difficult for them to interpret this information. And so health literacy was considered at all stages, and terminology. You have no idea how many reiterated versions of the way this information was presented have actually gone through in the co-design process. And it's never going to be perfect, but it was never designed specifically to say this is how you engage with this clinical group or this clinical group. It's really designed to be as generic and all-encompassing as possible, but also provide as much information as we can. Now, any other particular questions? I know you've been answering as you go along, Ashley, and so have a few of us. I might just quickly highlight a few of the others. So, for example, does the hub support consumers diagnosed with mental illness? We haven't specifically targeted for mental illness or for dementia. It's really more about how you can go about a process to engage more broadly. And there's also quite a few comments in the chat about engaging priority populations and engaging through strategies such as with community groups and with interfaith communities. There is resources on the hub that specifically address that. And in fact, there's about to be some further resources added on that in a project that was funded alongside this, also by MRFF, on engaging priority populations. So there's case studies on there with Indigenous and Vietnamese, as Ashley has highlighted in the chat, but there's also some specific projects talking about how you reach out to communities when we're not anticipating people are having to go through their GP to be involved in research, for example. Really, there's many different strategies here, including with the LinkedIn group, through the hub resources and through the AHRA centres. For example, Western Australia has been the sort of leader in this space, and off the top of my head, I think there's about 6,000 consumers in your network. Is that right, Deb?
Yeah, 6,400 people with a lived experience or organisations, across the board.
Brilliant.
So, yeah, and all of the AHRA centres are getting to the opportunity of actually promoting involvement opportunities, not necessarily participation in research, because that's a different category altogether, but opportunities to involve and inform. So whether or not that's research priorities or ideation, co-design, or the actual translation. And Ashley, I think you'd mentioned that as well. It doesn't matter where the lived experience voice is involved. It's great to have it at the beginning, but it can be incorporated at any point. And translation is better at every single opportunity where lived experience is informing. We've got these great results. What does that mean? How can this make the best difference possible? And so, yeah, it's never too late at all to be able to involve lived experience voices. And that's where research translation centres amongst AHRA are doing different projects, areas of focus with health services, clinical services, clinical trials, all sorts of bits and pieces. So that's a really good go-to. The hub is the centre to connect, but then to find out more that specifically fits your area of interest or area of research, or even for funders, this is intentionally there to help you navigate to find those people and those projects.
Thanks, Deb. And there's also, just looking at some of the questions, there's a really quite important one here from Brett, talking about a lot of work has gone into this, but this can often be a low bar and relatively tokenistic in terms of really taking on board lived experience. So what should those of us concerned about this do in this space? So this is one of the reasons for the project, Brett, was to actually move beyond that tokenism. And in fact, if you look through the hub, so one thing you can do is direct people who you're working with in your networks to the hub, to the definition of consumer and community involvement, to the levels and depths of consumer and community involvement, and to the critical need to move beyond tokenism. One of the things that I might just comment on, which is not specifically from this project, but more broadly, is that tokenism occurs when there is underrepresentation. So anything below 10 to 15% of a particular representation, it can often be tokenism. So be wary of the single consumer on a governance group. That is the consumer and community involvement. Ainsley, do you want to comment on that?
Look, that's absolutely right. And I think we are seeing the changes in that. I certainly am across Australia. Yes, this was how it was in the past. Now, even when I'm looking at reviewing grant applications, there isn't that sole consumer. So times have changed, and it's going to get even better.
Absolutely. And yes, Angela.
Helena, I was just going to say, one of the questions that we often get from researchers is, I recognise this is important, but how do I start? Sandy and I find this in particular in the work that we've done around supporting the Monash Partners community. And I just encourage people to dive into the case studies, because there are a number of researchers who talk about those practical first steps that they took and what that looked like. And I would say, don't sacrifice perfect for getting started, just make a start. But there is a lot of information in the hub to guide people around taking those first steps.
Very good point.
Absolutely. And just remember, as long as you keep in front of your mind, first do no harm, which includes not being tokenistic, and making sure you delve into the information that has been assembled from that national engagement. That's going to be really important. So fantastic. And some of the roles, there's some comments in the chat there about it being the role of consumers to make sure they avoid tokenism in these sorts of initiatives and make sure that there is appropriate engagement. So this now gives you a resource to be able to point to, which is evidence-based, not complete, not perfect yet, but far, far from where we were when we started. And as Deb said, there's a lot of other activities going on in parallel, and we will continue to iteratively improve this resource. But it does give you somewhere to go to say, if you don't know what you're doing, or if you are not confident it's not tokenistic, to be able to go somewhere to lean on that. I might also just take this opportunity to come back to Steve for any reflections, Steve. If you're there.
I am. That's Oh, I'm just trying to get my video to work.
That's fine. We can hear you.
There we go. Thanks, Helena. With no warning. But I've been listening and certainly following the questions, and I do think the questions are really interesting, and they do highlight, that there are gaps and really important gaps. And the one on dementia I thought was a really important one, because that's a really difficult area, but one that's so important. And I do think Dementia Australia probably do quite a lot of really good work in that space. And linking with them, I think, would be important. But I think we do have to make sure that we're not just picking the low-hanging fruit, but actually do the really difficult areas as well. And I'm not accusing us of doing that, but I think the comments, both in the chat and in the questions, highlight that. But we are committed to that. And obviously we're committed to the release of the new consumer statement. And I did notice someone asking why the statement so far, and the statement's not finalised, but so far isn't mandating consumer involvement. I personally think that we're better off talking about how really high quality research requires consumer involvement, and that NHMRC is looking for high quality research. And in fact, if you look at our success rates, we only fund really high quality research. It's embarrassing to admit, but our last ideas grants, which were released last week, had success rates of 8.1%. So if you're not getting 6s and 7s, you're not getting funded, and 6s and 7s would require really high quality consumer engagement.
Excellent answer. Very diplomatic, Steve. All right, we're coming to a close. So really, as we've said, this is about as rigorous and indeed, from what we can tell globally, is probably the most robust process to come up with national resources. There is also an organisational guide to assist our research organisations to enable this. And I know, having sat on NHMRC Research Committee for a couple of training, Steve, it's always a challenge to make sure that NHMRC strategy gets implemented by organisations as well as by individuals. So encourage those organisations you work with to look at their responsibilities and opportunities to implement around the national statement. We really look forward to Deb and Ainsley in their roles with NHMRC alongside Steve and MRFF to improving the system, such as trained peer review and high quality continuing evolution of consumer and community involvement research. And I want to thank this team and all of those across the country, including the case study leads, many of whom are on the line here, for their amazing involvement in this. And we will look forward to bigger and better things as we go along the journey. So thank you so much to everybody.
Thank you very much.
Thank you, everyone. There will
Thanks,
be an
everyone.
evaluation, and so we would ask you please to complete that. Any other ideas? And thank you all, the speakers, and for everyone for joining us today.
Thanks.
Bye. Thank you.
Thanks.